My name's Asha Cowie. I'm workstream lead for establishing the NHS Digital Academy. Fern, did you want to introduce yourself?
Sure. Hi, everyone. I'm Fern Cormier-Shaw. I am a project manager and I work with Asha on the Digital Academy project, specifically around developing a more inclusive selection and application process, which hopefully will be realised over the next few weeks.
Amy?
And hi everyone, I'm Amy and I am the programme lead for the PG Dip in Digital Health Leadership at Imperial College London.
Fab. I'm just going to get the slides up. Okay, brilliant. Can you see those? I can see Amy on my screen now and I can get a thumbs up. Excellent. The way this works now, you can only ever see one person while you're presenting. So Amy, you are the person I'll be looking at during this presentation. So, keep nodding and keep your thumbs up, thumbs down. So we've done our introductions. I'm just going to start off talking a little bit about the background and the future vision. Following this, Amy is going to talk a bit more about the programme in general and how the modules are set up, the support you'll get on the programme. And then Fern is going to talk in more detail about our approach to inclusive and transparent recruitment and more information about the selection criteria and so on. So in terms of the background, I'll start with the background for those of you that aren't aware. The NHS Digital Academy and the Digital Health Leadership Programme directly fell out of the WOCTA review and other recommendations back in 2016, where there was an identified need to develop and invest in our digital leaders. We have again selected Imperial College London as partners to deliver this programme, the Digital Health Leadership Programme, and they will be delivering with the University of Edinburgh and HDR UK. And it's been great to see the journey to date. And as mentioned, Amy will talk a bit more specifically about the programme structure shortly. Sometimes we're asked why the workstream is called Established in the NHS Digital Academy when it already exists, and this can sound a bit strange. But what we've actually got is we've got a really highly regarded oversubscribed programme, and over time we want to make sure we've got more offerings to meet a wider range of individuals. And over the last year, around this time last year, we started to develop a future vision. The future vision is now available on our website, and I just wanted to talk about these principles briefly. And this was built by talking to a whole range of people over that period, just to understand what the needs are, what the gaps are, and what do we want to do differently, really. And I'll just take this opportunity while we're on the call as well, just to thank anyone on this call who's contributed to this process. We had a lot of people share their ideas, both on surveys and on social media and stuff, to input into this work, and that's been really helpful. So in terms of the future vision, very much the first one is we'll have a suite of learning that's branded, reusable, accredited, curated and evaluated. What that means is people will recognise the NHS Digital Academy as a brand, and they very much already do. The content is reusable, so we can look at how can that be reused in different settings. It's accredited, so it's of a high calibre, and it's been accredited. Curated is about keeping it fresh. So how do we make sure that things are up to date and relevant, especially in an area as fast moving as ours is? And finally, evaluated, and that includes independent evaluation to make sure we're having an impact with the programme, and also things like our inclusive recruitment approach to understand, are we making an impact, the impact that we wish to do so. The second area is we want to include more programmes and learning to support change leaders in the earlier stages of their career and support local needs. So we'll be looking at, are there different levels of programmes over time? We're not sure. We need to understand what that looks like. But there's definitely a big demand for programmes like this. So we just need to understand what that is and build some of that into it to support the pipeline. The third area is ensuring we've got increased, easy and open access to Digital Academy learning materials. So we will start to really develop our online offer and make sure that there are more things that people can access and use and take back into their organisations as they wish to do so. And this will be both working with the Digital Health Leadership Programme as a flagship programme, and over time other offerings that we'll be looking to develop. The fourth one, and Fern will talk about this a lot more later, is developing and embedding a transparent and inclusive recruitment for our programmes, with a real emphasis on reaching underrepresented groups. So again, this will help with the pipeline and ensure we've got a real mixture of diversity on our programmes. And you know, in our area, I think you can cross-cut diversity in several different ways. Actually, this could be your, you know, experience in years, you have a diversity in that, and your professional role and background, and also protected characteristics. So it's very much about, you know, looking at diversity across all three of those areas. The fifth thing is we'll work with stakeholders to develop demand-led specialist learning. So again, we're not quite sure what this looks like yet. It will be probably linked to our online offerings, but we're conscious that there are more and more people wanting to develop and do things. So all of this is on our website, and we'll continue to share things as it evolves. And the last thing is we'll continue to create a supportive learning culture with signposting, so help individuals to look at appropriate opportunities based on their individual needs. And you know, this programme might not be for everyone, but there might be something better out there for you. So over time, we just want to make sure people you know, have a better understanding of what is out there and what they might want to do. So okay, onto the Digital Health Leadership Programme. I'm just jumping there. So me and Amy are going to tag team this session, and I will start with the first couple of slides, just talking about our timeline and where we are at the moment to date. So we've launched our new website, which hopefully most, if not all of you, have seen already. The link is below, and I think Amy or Fern will probably put that in the chat in a moment. And we're already open for Cohort 4 applications. The website is quite new, as mentioned, so if you've got any feedback on that, please do get back to us so we can continue to adapt and evolve it. But hopefully it's provided a really good repository of information as part of the application process. The application window will close on the 30th of April 2021, and following this we will be doing shortlisting with a view to notify individuals of their outcome by June, July. We'll also then make feedback and signposting available to all applicants by July, August. We are finalising this part of the timeline. Some of it will be dependent on how many applications we actually get, but once we've had the applications in, we'll update the timeline on the website so people are clear on expectations. The giving of feedback and more signposting this year is really important. It's something that we picked up on as part of our research, that not everyone was getting that and it wasn't consistent. So we really hope that will help both successful and unsuccessful candidates in the future following their application. Those who are successful will then complete an academic admission process with Imperial College London. We do want to highlight that we don't want degrees to be a barrier to applying. So it is not a prerequisite to have one. We know not everyone will have one. However, as part of the academic admissions process, you will be asked to provide previous academic experience, academic records or equivalent professional experience. But we just want to make it clear this is a really well supported process, and it's just as much for you to understand whether this is the right thing for you as well. And if you're concerned about this step at all, please contact us beforehand. Please don't let it put you off applying. I've got the residential dates up there, and our preference for Cohort 4, as long as it is safe to do so, is to include a minimum 3 days in-person learning over a 2-day and a 1-day block. In addition, there will be an in-person graduation ceremony. Residential 1 will be taking place on the 21st to the 22nd of September 2021, and Residential 2 will be taking place from the 7th to the 9th of December 2021. These will both be virtual. We will update the dates for Residentials 3 and 4 as soon as possible. I think we will hopefully have those in the next week or so. We'll include them on our website, and you know, as soon as we are able to confirm how they will take place, we will update that. But you know, I think we all know we're in the middle of a global pandemic, so we're just having to be a bit agile with our planning for that. So who is it for? Fundamentally, applicants need to be working in an NHS, public health or social care role in England to apply. We know that job titles and responsibilities are incredibly varied in this space, so we wouldn't want to exclude individuals based on that. The applications for the remaining 3 nations are not yet open. This is for England, these 100 places, but we are currently exploring what the provision for the other 3 nations looks like. We'll share that on our website, and we'll tweet about it as soon as we've got an update on that. The NHS Digital Academy Digital Health Leadership Programme is fully funded by HEE for those 100 places in England. This includes the overnight stays for multi-day residentials, And individuals and their organisations, however, would have to pay for travel costs and other expenses such as meals while travelling. And if you want additional accommodation, for example, either side of a residential. But all of your academic learning and the teaching and everything like that is all fully funded as part of the process. We do have some entry criteria which are listed on this slide. For the first point, applicants need 3 to 5 years of relevant experience in informatics and digital health. We really want to stress that for some of you, this might mean drawing on your previous experience in roles where you were involved in digital informatics, but you might have not had a formal job title as such. So try not to get too hung up on the job title and focus more on what you were involved in and what you did. As we know, some people might be actually have involved in this for several years around the edges, but they might have not been in a formal role, you know, till the last year or so. So focus more on your experience rather than getting so hung up on the job title. You need executive level support from your organisation. You'll need to be able to attend all experiential learning and live teaching, which as mentioned may be in person or virtually. If you do have any special requirements, contact us before in confidence. We can talk to you about this and it will not affect your application score. You need to be empowered and supported to apply your new skills and learning and behaviours to projects within your organisational system. This is why the exec level support is really key. We want individuals on the programme to demonstrate their commitment to professionalism of our workforce and to embed the learning back in their organisations and systems. And finally, sounds a bit cheesy, but we do want you to have fun and we want you to enjoy the experience. So I think this is the last slide from me before I hand over to Amy. And this is just really touching on, you know, what will you do differently from taking this programme? So as part of the programme, you will start by setting out goals for the year ahead in a personal development plan, which should be agreed with your exec sponsor. On the note of exec sponsors, we've got an exec sponsor video on our website and there will be support available for exec sponsors. I think Amy will talk about that a little bit as part of her slides. Sorry, I'm jumping into your slide now. But basically, agree that with your exec sponsor. And then from the start and throughout the programme, you'll be expected to engage in reflective practice about how you're progressing towards your development goals. As part of undertaking the programme, you'll need to identify themes or programmes of work which are of strategic benefit to your organisation. You will then apply your learnt skills and knowledge to practice in the workplace using these themes or programmes of work, and this will enable you to apply best practice models, frameworks and approaches within your workplace. Throughout, in order to support your reflective practice, you will use learning journals. You will use learning journals. I always say lose them. We don't want you to lose them. So you will use your learning journals, and you know, we know reflective practice can be a bit strange if you're not used to it. I do it all the time now and I love it, but it's definitely something that takes a bit of getting used to. And again, you'll be well supported with this. And by doing the reflective learning and using your learning journals, you'll be able to capture translation of your learning into practice and understand how you're achieving that real world impact and change. And finally, at the end, you'll celebrate completion of the programme, presenting highlights of professional growth and impact in the workplace to your peers. The recommended study time is about 5 to 8 hours per week on average, but it could be up to 10 to 15 hours. And this will include approximately 3 hours in engagement with online content, 2 hours of core reading, and additional time to engage with your peers. During assessment weeks, these hours will be put towards completing specified assessments, and your time, you know, that will depend partly on your personal preference and also your personal learning style and whether you've done something like this before. So I'm now going to hand over to Amy to give a larger overview of the programme in more detail and support on your learning journey.
Thanks, Asha. So here you can see the kind of overarching academic learning journey for the duration between September until you finish the program next year. I wanted to give you a quick glance across the program. We'll start the digital onboarding towards the end of August. This is the place where you will have access to Imperial College's resources, also academic tutoring and pastoral support, and short modules preparing you to write and work at a postgraduate, UK postgraduate academic level. And then, as you see on the journey from Module 1 onwards, we'll be giving you a grounding and an overview of health systems, and gradually we're going to move toward more specialist areas. as the program progresses. The modules are delivered online using blended learning, live sessions, and also assessment tutorials. So you're never going to feel like unsupported in how to put your learning into either to an assessment or indeed implement it at work. And this is where we arrive to module 6, which is the leadership module that you can see at the bottom left corner of the graphic there. And this runs across the year. It is parallel and in dialogue with all your other modules. And it will begin at the start with your establishing your personal development plan and getting your executive sponsor to discuss that with you. And it will work across all other 5 modules. It will help forge you connections across the cohort to collaborate with others. It will guide you how to apply learning to work in more detailed and through examples and exercises in a more granular form. And it will also inform your reflective practice that will accompany this learning journey. So this is that. And next slide, please. In the great tradition of the government briefings. So I wanted to speak briefly to support on your learning journey. So as Asha said, we do not require an undergraduate to second degree to apply to the program. But we want to ensure that the academic integrity and quality of the program is sufficient to what you're looking to achieve. And so we put a bunch of resources in place. So don't get overwhelmed by this. I will just pick out a couple to exemplify this. So the Imperial College itself has a vast amount of resources, whether it's accessibility, learning differences, and if you need assessment on those, we are more than happy to support and signpost those and then put the provisions in place to support your journey. One of these, which we are really quite proud of, is the academic tutoring. We have dedicated teaching fellows supporting each cohort, and their work extends from, just kind of pastoral support and making sure that everybody's progressing okay with the program to more bespoke one-to-one tutoring should you need that, or should you arrive to a point where you are struggling a little bit with 1 or 2 assignments. So that is a point of pride for me. They are in my team, and I'm very glad that they are. When it comes to pastoral care, we've seen COVID-19 happen to us and Cohort 3 currently, who are delivered entirely virtually throughout the program. They have seen a lot of redeployments, changes in circumstance, whether it's a new baby or a wedding postponed or some unavoidable travel. So we are able to support you in these circumstances as well. I want to touch on the role of the executive sponsor, because it's very important that you have an ally at work who can support you and who will enable you to translate your learning into practice. They can also act as a mentor throughout the program, and we are very happy and look forward to brief them. I've put really quickly the exec sponsor briefing link into the chat as well, if you want to share it with someone whom you're hoping to win over as your exec sponsor. And finally, there is the broader NHSDA family community. If you search for the hashtag on Twitter, you'll find the people who are going through or have gone through the program, and they are quite active on Twitter. That seems to be the kind of go-to place. And they will be also part of your learning journey. We hope to incorporate them in your peer groups, which are regionally organized, so you can get that cross-cohort networking and developing broader communities of practice through the program. So I'll finish there, and I'll hand it over to Fern.
Thanks, Amy. Hi, everyone. So I think, so Asha, were you going to take the next couple? Sorry.
Oh, yeah, no, that's fine.
My bad, sorry.
No, don't worry. It's all good.
That's all right, don't worry. So I'll just briefly talk a bit about our inclusive and transparent recruitment before we move on to the application process itself. So as part of the future vision work we've been doing, an evaluation scoping exercise, it did become evident that we needed to do some work, support collaboratively around inclusive recruitment. A full report is available on our website, so we won't go into too much detail, but we are pleased to have strengthened our practices ahead of Cohort 4, working closely with Imperial College London as part of this work. This includes, for example, ensuring we're increasing reach to previously underrepresented groups, sharing a more transparent assessment criteria, which we're doing on the call today and through various resources we've got, and also increase the diversity of our shortlisting panels. So we have introduced 10 interventions over the 6 areas on the screen: advertising, application, shortlisting, scoring, feedback and evaluation. So do feel free to have a look at that report if that's of interest to you. And actually today, NHS employers have actually just released an inclusive recruitment report, which is quite interesting and full of case studies for anyone who's interested in that area, as an aside. So while we've introduced 10 interventions for Cohort 4, there's more that can be done, and more that will need to be done in the future. And I just wanted to talk briefly about some of the things we need to do going forwards. So we will look at our Cohort 4 data to understand actually where are we losing people. Is it reach? Is it application? Is it shortlisting? We'll then identify and understand our gaps, building on the learning we've already done for Cohorts 1 to 3. So if we were to compare it with what we know about the workforce, actually have we got a similar people applying, or are they not even applying to begin with? We then want to identify opportunities to help these gaps, and that could be planned products, some of which we do. It could be signposting to additional support. And basically we'll keep learning. So we won't get this completely right the first time, but we'll keep learning, keep evaluating to support increasing diversity for the future pipeline. We are also well aware that this is not the answer to everyone, this programme, and we hope that over time, having more additional offers we wish to put out alongside wider work will help to plug some of these gaps. And I just also wanted to mention that part of the Federation for Informatics the Federation for Informatics Professionals vision, I'm getting really tongue twisted today, sorry, does include helping individuals to find the learning, training and development that you need now and for your career. So we'll continue to work closely with FedIP and the member professional bodies as part of this work. That includes people like FCI, BCS, APFA. FedIP are due to start a consultation from 1st of May, which actually includes a focus on the role of professional bodies and FedIP. So we'll post a link to the chat if anyone is interested in that in particular, as we do, I think, on every webinar so far, we've been asked about sort of professionalism and careers and stuff like that. So just wanted to let you know about that, as they're here to, they're keen to hear what you think about their vision, and you might have ideas to support that piece of work. So on to Fern.
Thanks, Asha. Now on to kind of the application side of things. So you're probably interested in what we'll be asking you as part of the application. So other than your sponsorship and personal information, you'll also be asked to provide the answers to 4 key assessed questions. These questions will be what are used for the shortlisting, and they will be scored objectively. Each question is 2,500 characters, which is approximately 400 words. We had to, using the online form that we're using, it had to be in characters, not words, which is why we've done it that way around, unfortunately. But please keep that in mind, and maybe draft it offline is quite a good way to do it just before you kind of complete the actual form. You can save as you go, but just in case that's a barrier. And for those 4 assessed questions, please do not include any personal details, because we're aiming to shortlist all of these blind, so that there's no, well, we're limiting the amount of bias from our shortlisters. We're sharing this information up front. We want to be transparent, and we want you to know what our shortlisters are going to be looking for. So this might help you to determine whether you're currently in a role where you'll be able to actually apply the learning from the programme. It's also really important to note that when referring to clinical versus non-clinical experience in this section, the reason we explicitly state this is just because our inclusive recruitment research has indicated that some people felt that having clinical experience was a barrier for them to apply for the programme. We just want to be really clear. You can apply for this programme whether you're from a clinical background or otherwise. Next slide, please, Asha. Fab. So sorry if this is a little bit I appreciate there's a lot of words on this slide. You should be able to zoom in yourself using Control Plus if you can. I know we're having a bit of issues with the zooming in feature, but also these slides will be shared. So if you can't see them now, don't worry too much. But basically, this is just a bit of an example of what we're looking for from one of the questions, which is the first question. We have published all of our shortlisted criteria on our website. It's in the offline version of the application form, which you can find on the website, which we've already put in the chat. So you can view basically what we'll be marking applications against up front. And this is just an example of that. So the first question is, please provide information on your current role, professional experience, and strategic responsibilities related to health informatics or digital health. Again, we've just reiterated the note about clinical and non-clinical experience. So we've got some positive indicators on the left-hand side. And then on the right-hand side there, we've just gone into a bit more detail about kind of what that actually means in practice. So, you know, you've got to have a relevant role in health informatics or digital health within the NHS or social care or public health. We don't accept applications from private sector at this time. But we know that job titles can be really varied. So, you know, please really go into depth about your experience and your role in influencing decisions in relation to digital in your organisational system. You know, you do have to have a really clear role in leading and influencing decision making and digital delivery within your organisation. So in your answer, you really want to use practical examples of when you've done this, or where you can see opportunities to do this going forward. Again, we've just reiterated that there's no preference given between clinical and, I know we hate the term, non-clinical roles, as long as you can evidence the appropriateness of your role towards this programme. And finally, we're really looking for a detailed description of your professional experience and an indication of your strategic responsibilities or potential. So this is the bit where you'd maybe go into your 3 to 5 years of relevant experience, which is part of our essential criteria. As Ash has already highlighted, that 3 to 5 years experience might look very different to different people. It doesn't always mean having digital in your job title, we know that, but please try and draw on your experiences over the past sort of 3 to 5 years. Go on to the next slide, please, Asha. So we're not going to go into detail out of all the questions here, because you can, as I said, you can view all of this criteria directly on our website in your own time, but hopefully that just gives you a bit of a flavour and understanding of kind of what we're looking to draw out from your experiences when you're completing your application. Next slide, please. So we have got a range of additional support for you available throughout the application process. So we've got an application checklist on our website, and again, we've got that shortlisting criteria available there, and an offline version of the application form. So you can look at it, review it, make notes, all of that stuff before you actually complete it. We're hosting multiple drop-in sessions of webinars. So like the one we're doing right now, we have another 3 later in the month. So, you know, come to as many as you like, depending on, you know, hopefully you're getting your questions answered. And you can also contact us via email. I think we've already put that in the chat. We're also hosting panel sessions with some alumni, so you can really hear from their experiences. Again, you can sign up and register for those on our website. We've already had 2, and they've been really, I think they've been really helpful so far. So please do sign up for the remaining 2 that we've got. We've got one tomorrow and another one next week. We have lots of online content, videos, case studies, a video highlighting the role of the executive sponsor. We've asked some of our alumni to complete some Twitter stories. So if you're on Twitter, do check those out. And please do get in touch with us via email or Twitter accounts if you have any questions at all. Next slide, please. So this is just showing you some of our upcoming sessions. So as you can see, we've already had a few, but we've got a few left. So if you're interested in attending any of these, please do register on our website.